My name's Rick Peak. I'm the Division Director of Gastroenterology, Hepatology, and Nutrition here at Vanderbilt. Making the fellowship the centerpiece of our division is really my highest priority.
The Gastroenterology program at Vanderbilt is an exceptional program. We offer the full depth and breadth of experiences within gastroenterology, including nutrition, transplant hepatology, specialized care in inflammatory bowel disease, therapeutic endoscopy, and close access to our Veterans Administration Hospital.
You're going to get national experts in every single one of these areas.
There's a unique opportunity to work with leaders in the field, no matter what their interest is.
Vanderbilt has really strong subspecialties in all different areas of GI, and I felt that was one of the reasons I wanted to come here.
We see such a wide array of diseases, whether it's the bread and butter gastroenterology to very rare diseases.
Between being able to do clinical work and endoscopy both at Vanderbilt and at the VA, you really get everything that you need in regards to your clinical expertise.
One thing I've liked about Vanderbilt a lot is that the VA and Vanderbilt are on the same medical campus. And so you're able to drive into the same spot every day.
It is just across the bridge, so they're actually connected, so you don't even have to go outside.
You will see a lot of patients. You will do a lot of scopes.
Not hard to learn because we have so much volume. You're going to learn just by being out there.
You don't really have to go somewhere else to kind of experience anything. You have pretty much everything here.
They get exposed to really, really complex patients, and that's what you want in your fellowship, so that you, when you go and you become an attending, that you feel confident in the decisions that you're making, because you've seen all of that before. Once you train here, you have seen all of that before.
Not only will you get wonderful training in gastroenterology in general, you will also have access to all the subspecialties that you might need in case you decide to go in any of those subspecialties.
If you're a fellow, that's exactly what you want to look for in a fellowship program, because you might come in thinking you want to do esophageal disorders, but if you learn that you want to now do IBD, you want a program that helps you support that and help you grow that interest.
Your needs may change. Being in a place that's large enough to accommodate your wishes and needs and growth makes it special.
We put intentional flexibility into this program. That means that your journey through here as a fellow is going to be unlike anybody else's.
I came here initially expecting to do 3 years of gastroenterology and then doing an additional year of transplant hepatology, just because our program didn't have the pilot program per se. But once I got here and they knew my interests, they were immediately open to pursuing a pilot program and allowing me to complete my training in gastroenterology and transplant hepatology in 3 years. So I felt like I was really well supportive, and it was a big surprise for me that was really welcome as well.
We will not dictate to you what we want you to do. You will tell us sort of what areas that you want to pursue in greater depth, and then we'll schedule your rotations in research and clinics to really allow you to become an expert in that area.
The research enterprise at Vanderbilt is truly outstanding. We encompass not only the full gamut of basic science, translational research, as well as clinical research, but we also have a lot of cross-institution research and cross-disciplinary research.
What attracted me is that I would be able to see a lot of patients, but then I would also be able to try to improve my research acumen.
They've been really helpful in allowing me to merge both gastroenterology and informatics together in a way that has not really been done before. I can think of 3 people in the nation who are doing this type of work that I'm doing, and I'm one of them.
I've tried to build a culture here that really embraces individual interest and allows you to pursue goals and passions within the framework of an incredibly rich fellowship.
I think there's a number of institutions that you can get a good GI training. I think the thing that really set this place apart was the fact that the people here, the culture of this program really felt like one that I wanted to be a part of.
You want to find a place where you enjoy the attendings, you enjoy the people that you're working with, not something that I found here at Vanderbilt.
I've trained at a lot of institutions, and I could tell you one of the things that really is exciting about our program is just the level of camaraderie that our fellows have for each other.
They work tremendously together here in the hospital, but form exceptional friendships that extend beyond the hospital.
Not just attending social events with each other, but also truly caring about the lives and well-being of one another.
That really is something that I admire and that I think sets our fellowship program and our fellows apart from other institutions that I've seen.
It's more than just collegial.
It's really like a family atmosphere.
You can really see it and you can feel it when you're here among our trainees. And I think that also holds true for our faculty, in that we really and sincerely feel and care about people and their well-being.
We've had hardships amongst fellows, and just to see the whole community, not only the co-fellows, but all of the attendings as well, coming together to support each other. It's just a great thing to be a part of.
You always get a little nervous because you've gone from being the top dog in residency to now being the kind of bottom of the totem pole again. But I've felt incredibly supported. I've felt to be made like equal as any other member of the team.
We don't treat them just like workhorses or to type notes or something like that. We find that we really want to integrate them into the team.
All of our fellows have our cell phone numbers, so they're welcome to text or call us anytime.
I've never had a problem where I wasn't able to reach a faculty.
You want to know that you can work with people that you're going to get along with in the middle of the night when you're calling them in and everyone's a little bit sleep deprived.
We work very hard, and Dr. Obstein in particular works very hard in trying to make sure that the experience is educational and not just like a scut work experience or anything like that.
It starts from the top, with our chair and our program director, but working all the way down to our support staff, our nurses, our techs. We enjoy coming to work each day and working together as a team.
The things that I would advise that an applicant look for is first of all, breadth of experience you're going to get. Since everything gets referred in here, you're going to see it all. Second, do they care? Do they care about the fellows? And do they if there's an issue, will they work hard to fix it? As a program, we have many, many times. And then lastly, are you going to actually enjoy living there? 3 years is a long time to be miserable.
One thing you'll enjoy about being a fellow here is that you now have more time off than you had as a resident.
There's so much to do here.
My experience moving from the north to the south has been great.
You can go 15, 20 minutes away and virtually not even know you're still in a major city.
There's pretty much no matter what phase of life you're in, it has a lot to offer.
I've been enjoying living in Nashville a lot with COVID, so I'm pretty sure it's going to get better after COVID.
There's an energy to this city that really draws young people.
It's a great place for people that are fans of music. Even if you're not a fan of country music.
When I moved here, I wouldn't pick Nashville out of a hat. I came here for the job opportunity, not really knowing what the city was going to be like, but I think it would be very difficult for my family and I to leave now.
Thank you again for applying to our program. We have an outstanding program here at Vanderbilt, and one that certainly will help to promote your career, your interests, and help you to be a leader in the field.
We would appreciate not only any feedback from your interview day, but we'd also, appreciate you considering this seriously going forward.